Hey, dear mamas, sisters, mothers, daughters. Now, I recently shared on my Facebook page a story of a 16-year-old who came to our facility in a lot of pain. And she kept bending and holding on to her abdomen as a way to just try and speak to the pain. Like, you have to stop. This is too much. And upon arrival at our emergency department on the side of reproductive health, I got to have a look at her and chills ran down my spine. She was only 16 years old and in a lot of pain. I wouldn't wish anyone to be in such kind of pain. And so quickly, I took her in, took a brief history, and also did a quick examination on her to try and find out what actually was the cause. And after a quick review, high in my index of suspicion was, could this girl possibly be having an ectopic pregnancy or a ruptured appendix? But then I probed further, and the history was that she had not engaged, or rather, I think the question I asked her was, when was the last time you got to see your menstrual period? And she told me, Doc, I have never had my periods. I don't even know what that is about. How old are you? I'm 16 years old. And what happens? Tell me more. What happens? Tell me more about this pain. Is it the first time you're experiencing it or you've had it before? And she told me for the last about 2 to 3 years, she has been having this pain that comes almost at the end of every month for like a day or two and then resolves. But now this time round, it just kept becoming worse. And before her coming to hospital, it had actually started like a day prior, and she thought it was like the other kinds of pain. But this time round, it did not resolve, but it persisted and became extremely severe to the extent that she wasn't able to do her normal activities, and that is why she came to hospital. And that was thing number one that made me really think, like, you are now 16 years old. Is it true that you've not seen your menses? Or is it just a story? And so I kept probing and I asked her, do you think you could be pregnant? And she told me, no, I have never engaged in sexual intimacy. And at that time I told her, it is not that I do not believe you, but I want to do what I can do in my capacity to help you. So I sent her for a quick pregnancy test because I had to seek consent if she was really okay with me doing this. And she was okay. So I had to send her for a quick pregnancy test and at least do a urinalysis, a urine tract, or rather a urine investigation. And then besides that, also do an ultrasound to see what possibly could be going on. And so the pregnancy test results came back. They turned out to be negative. The urine was okay. There was no infection. But then came the ultrasound and the findings, distinctive findings. And the ultrasound showed that there was a lot of blood in her uterus, or rather womb, and then just in the area beyond the cervical region around the vaginal area, inside her body, was a lot of blood that had collected. And so my mind started racing. Could I be dealing with a case whereby I'm having a patient who's actually getting her menses, but for one reason or another, they're not able to come out of the body? And so we did a quick examination and actually, rather a more detailed examination, and actually found out that this particular lady had what we refer to as an imperforate hymen. It means there's an obstruction outside the uterus that cannot allow the blood to come out. And so, dear mamas, sisters, daughters, and mothers, could you be knowing of someone who is experiencing this? Then kindly refer them to a gynecologist. Let them get checked. And in the next episodes, dear ones, we'll be talking about 16-year-old and you've never seen menses. Should you be worried or should you just wait? And that is it for today. Karibuni sana Mamascope Diaries, and feel free to share your experiences.